Well, the U.S. marking a big milestone in the pandemic with half of all adults fully vaccinated against COVID-19. That's at least according to the latest data out of the CDC. The Biden administration, of course, has set a goal of 70% vaccinated by July 4th. But with a new variant emerging outside of the U.S., there are questions about whether, in fact, that could derail some of the progress made here. Let's bring in Dr. Jeremy Faust. He is emergency medicine physician, Brigham and Women's Hospital. And doctor, I want to start with the concerns around this new variant, because we have seen a number of Southeast Asian countries act largely on concerns about the variant emerging out of India. What more do we know about it when you compare it against the UK variant, for example, that's raised so many concerns here in the US?
Thanks for having me. I think that this variant is showing some signs of being more contagious. Similar story that we had with the UK variant, as you mentioned. The UK variant, more contagious, maybe a touch more in terms of fatality and disease burden, but really nothing out of an order of magnitude difference from the UK variant. And so that seems to be sort of the same story with the India variant, but we don't yet know. But even if this one is more contagious than the UK variant, that really augurs that you could have a lot of spread. The place that worries me, as you mentioned, is actually in places where you don't have the vaccine.
Yeah, and the reasons for that obviously are clear, but it comes at a time when we're talking about now teens getting vaccinated here in the U.S. I mean, as a doctor, watching this all play out, knowing how the healthcare workers across the globe have been impacted, what's your take on maybe what more should be done there in the U.S. sharing vaccines with the rest of the globe?
Yeah, so Zack, you've got two competing issues. On one hand, you have vaccine equity and the fact that all around the world there are geriatric people who are retired, even healthcare workers on the front line who don't have a vaccine yet, and they're putting it on the line every day, and we're vaccinating a low-risk population here in the United States. I think the approach to that has to be not no but yes and. Yeah, we have to vaccinate as many people here as we can and also push vaccines overseas. There have been a lot of different ways to do that. People are talking about tech transfer and IP waivers. There are a lot of ways to do that, but I think number one thing you do is just do everything you can, and that's all you can possibly ask. The problem with the variant, I think, is we're talking about is that I'm not really convinced that the vaccines won't work against them. I still think that we've been fortunate that the vaccines have worked. The issue is in places that don't have the vaccine, they have to do all the things that we spent the last year doing, which is wearing masks and staying home. It's really hard to control this virus. We all know that. And so any version that's more contagious just means that you have to be that much more careful until the vaccine shows up in your neighborhood.
So what does that mean for the progress that's been made in the U.S. here? You've made this point several times, which is it doesn't matter how far along we come in the U.S., given just how interconnected things are. If you can't control it abroad, there are always chances of it sort of picking back up here in the U.S. I mean, what you said right now seems to suggest that regardless of the infection rates abroad, you think that the vaccines will hold so long as, a majority of Americans are vaccinated.
Yeah, barring a new variant, I think that's absolutely true. I think that the other problem is that with a variant that's more contagious, you really have to worry about the population that isn't vaccinated. So kids, right? So this virus absolutely hits older people, order of magnitude worse than younger people. But younger people still do get hospitalized. They still, even in a few hundred cases in the past year, we've had fatal COVID infections in people 0 to 18 years old, like literally 300 or 400 of those. So we don't want to court that danger. And parents are really concerned about all kinds of side effects, and they're not sure whether to vaccinate. And so the sort of vaccine hesitancy or vaccine deliberation can really cost us in terms of getting back to life, because if infections start roaring through a community, people get scared. Even if most people are vaccinated, they're just scared of cases at this point, which may or may not be the right thing to be scared of. You want to be scared of a disease that hospitalizes you, which is what we've had up till now.
Dr. Faust, last one from me when it comes to kind of this back and forth over the shift in policy at the CDC around vaccines and what Americans who are vaccinated are able to do according to those new guidelines. And the thinking was you're incentivizing people to get out there and get vaccinated. But largely, we're not hearing reports of businesses going out there and checking for vaccine cards or having anyone really prove that they have been vaccinated. Just curious to get your take maybe on how it could be backfiring a bit here if everyone's just kind of trusting the people who say they're vaccinated are, and whether that could have an unintended consequence of not hitting President Biden's vaccination goals.
Yeah, absolutely. It's really in our hands to be good neighbors and good members of our community and just to tell the truth of what's going on. I think that on a individual level, on a going into a store or going into a wherever, it's pretty hard to deal with enforcement. I think that's actually why the Biden administration has tagged this 70% goal. The idea is if we get something closer to herd immunity, then essentially on a macro level, then we can sort of say, well, enough people are actually doing the right thing that even the few bad actors within that 30% of people who have chosen not to be vaccinated or people who cannot be vaccinated for a number of reasons are unlikely to even be infected. So we really aren't talking about herd immunity, but if you really stop and think about it, that's what they're doing. They're trying to say, look, let's make the numbers stack in our favor so that we don't have to worry about a few people who may or may not be up on the up and up about their vaccine status.
Dr. Jeremy Faust, always good to get your insight. Emergency medicine physician at Brigham and Women's Hospital. Good to talk to you today.